Well, it's important to change these laws because people are dying. People are dying because they don't have access to naloxone. For the record, my name is Joseph Joshua Livernoy, and I'm speaking to you on behalf of Northern Nevada Hopes this afternoon, as well as myself. The first time I ever saw a vial of naloxone.
Naloxone is a medication that can be given through injection and sometimes nasally that can reverse the negative outcomes of an opiate overdose. Well, the changes that we'd like to see is a comprehensive Good Samaritan law that would save lives, as well as a more comprehensive and broader-based naloxone access. These changes are necessary basically to save lives. My daughter died from a drug overdose, a multiple drug overdose, and had the person she was with called 911, even though there were drugs around, she might have been saved and might be alive today.
For the record, Dr. Tracy Green, I serve as Chief Medical Officer for the Division of Public and Behavioral Health. You know, the misuse and abuse of prescription medications has taken a devastating toll on public health and safety across our nation. We've seen a dramatic increase in substance abuse treatment admissions, emergency department visits, and most disturbingly, a dramatic increase in overdose deaths due to prescription drug abuse and misuse. The Centers for Disease Control and Prevention has characterized prescription drug overdose as an epidemic. According to the CDC, overdose was the leading cause of injury death in the United States in 2012. In that same year, drug overdoses killed more people in the ages of 25 to 64 years of age than motor vehicle crashes.
What we're really pushing for is specific broadening of access to naloxone. Right now, naloxone is already legal. That's great. But the way that it's distributed is not it's not a common sense way to distribute an overdose prevention substance, because of the fact that it's currently only available by individual prescription. So I'm opiate dependent, I'm at risk of overdose, say. So I go into the doctor and I ask for a prescription for naloxone. Okay, that's great. But if I'm in the midst of an overdose, I'm not going to be the one administering it to myself, right? Somebody else is going to be needing to do that. These provisions are going to make it easier for the people that are actually more likely to be responding to overdose to administer naloxone, and most importantly, have the access to naloxone that they lack right now.
The chief clerk will open the roll. Does anyone wish to change their vote? The bill having received 32 ayes, 10 nays, and receiving a constitutional majority, I declare it passed. The bill is ordered transmitted to the Senate.